Hello, my name is Takia Jones and I am serving as a juror on the case for Alicia Troy versus Ashford Hospital. Alicia is the plaintiff and she advised that Ashford was improperly releasing her information to her supervisor the day before her surgery. The plaintiff Alicia is charging Ashford Hospital with violating HIPAA. Her personal information was released to her supervisor without her written consent. In accordance to the HIPAA mandate that became effective April 14, 2001, there was a mandate. There are national standards for the protection of health information. There are three entities: health plan, healthcare clearinghouse, and healthcare providers who conduct healthcare transactions electronically for patients. By a staff member electronically sending the schedule to Alicia's supervisor, her privacy was violated. Not only did it contain the OR schedule, it also contained demographics: her address, her social security number, former surgeries, psychiatrist information, her medication list, amongst other things. The hospital, as well as the staff member, should be held responsible. The hospital admits that they have placed the employee on administrative leave, but was she thoroughly trained before she was performing her job duties, which allowed her to make the mistake of sending Alicia's information to her supervisor? Did she have in-servicing on HIPAA and patient privacy? How often is the training redone? If laws change for the Privacy Act, is there training that is redone for the staff? Making sure that the staff is aware of the policy will help prevent issues like this in the future. Alicia's supervisor is not part of the operating team. Therefore, receiving Alicia's information was not necessary. There is no written consent from Alicia authorizing her information to be released to anyone that is not involved with her surgery. The plaintiff advised the Electronic Communication Privacy Act of 1986 advises that it's a violation when any communication or email is given to an unauthorized person without consent. This is proven to have been prohibited in this case. Defendant Ashford Hospital is advising they do not disclose information without a patient's written consent. The employee is an employee of Ashford Hospital. They violated this order and sent the information without written consent. Ashford also advised that hospital department heads have extensive training when it comes to privacy information for patients. The entire facility should have that same extensive training. The defendant also advised that many people have access to patient files, and that this is the first time that the hospital has had this type of occurrence. Privacy refers to an individual's expectation to keep control of his or her individual space, as well as knowledge of certain private information. A patient's nurse or healthcare provider has a duty to provide privacy to those they treat. The right is guaranteed by the Health Insurance Portability and Accountability Act. A patient has a right to privacy. It is their legal right to control access to their private information. Once an institution or person is entrusted with otherwise private information or access, the duty of confidentiality restricts the disclosure of that information without permission or strictly defined necessity. After hearing both sides of this case, I find that Ashford Hospital should be found guilty. They failed to protect the privacy of Alicia Troy's medical and personal information. Thank you.